Does it eventually lead to surgery, though? Because replacement surgery isn't really the first option. It's pretty far down the list, yes?
Typically, what physicians recommend is that if you start to have pain and altered movement in a joint, that you might start with physical therapy. Physical therapy will work on regaining comfortable, healthy joint motion. It will work on strengthening the muscles around the joint and the muscles throughout your whole body to help to support that joint. And oftentimes with a good regimen of physical therapy and then follow up flexibility, mobility, and strength exercises, you can remain comfortable in that joint and function healthfully for quite some time. Then your next line of defense might be some injection therapy that your doctor might recommend. There are anti-inflammatory injections like cortisone that can be applied. There are joint lubrication injections called viscosupplementation that help to kind of improve the lubrication mechanism of your joint. Those might be applied. And then going on from there, there are some other slightly more experimental medication or injections like PRP and stem cell therapy. You might be hearing about those in the news and in the scientific literature. And then if your body still has a lot of pain, a lot of decreased mobility, a lot of decreased function, if you're just not able to do your activities of daily living, then your surgeon may start to recommend a joint replacement surgery for you.